Okay, now.
Hi sis, thought it'd be easier just to show you what to do to take care of Dad. In here, in his compartment is a handy little bag with everything, and the wound wash right here. So we take this. I'm going to simplify things because we've had a week under our belt and things are getting a little bit better. It'll be easier for you to take care. So here's what we're going to do. Alright, Dad, let's stand up so we can take your shirt off. Stand up. Okay. Alright, we're taping this right now so Diane can see what to do to help you fix your arm up, okay? So Diane, you're on camera right now. Alright, smile. Alright, we're going to take this off. Bad arm first, which is the left arm. Okay? We pre-staged that, taking the sweater off. Okay, you can go sit down now, Dad. You can go sit down. Alright. Now, we have this bandage. A little easier, simplified this time. First of all, Dad has a wound up here that's very, very nicely healed. And I do have a Tegaderm patch on there right now. And I'm going to take that off. It gently, gently peels, holding the skin. You will not need to do this one, Diane. This one we will take care of before you go, before you come. He will be just enough, and I'll show you what we're going to do. This is the other wound. So I have Dad rest his arm on the pillow.
Oh my God. She'll have
And
pillow
here.
all the cover on. Ooh.
And here, we cut this off. And remove the, here Dad,
Would
lift
I
up your
bother you if I get by, Adam, or are you
Lift
doing
up
something right
the
now?
Tegaderm patch.
Oh, wait, no, I'll wait.
Okay.
I'll
Now,
wait right here.
we need to clean the wound.
Wait right
So
here.
in the bag are these little Q-tip sponge pads or whatever they are, little gauze pads like nail polish removers. I use those. I soak these and very, very lightly. What I'm doing is clearing off the neosporin that's been on there, cleansing the wound very, very gently. This is the wound you will be caring for. This one here you won't need to do because I think it's going to be sufficiently healed. We're going to be okay. I'm going to put it on tonight and take it off tomorrow before I leave. But he should not be bleeding there anymore. So once you've done that, let that dry. I'm going to reach in here, get the neosporin, get Q-tip, put some neosporin right now on the Q-tip, spread it just on the wound, and then just on this wound, very gently. This one's much smaller than the other injuries have been, which is good. Now, also where the neosporin is, are these Tegaderm patches. I'm going to take out 2 of the small ones. There are large ones in there that we're not going to use at this point.
Sure.
So here's the small Tegaderm film. You separate it this way. Now you're left with this. You pull this apart and then it becomes very sticky, so you need to, and again, you're not going to be doing this one, but I'm centering it. You then zip it around and gently tape it in. So I'm going to do the second one, the one you'll be doing. Again, you pull this apart, you peel the back off, holding it. Dad, lift your arm up. I need you to give a little bit of a crook. Now we're going to set it right in the middle. Gently push the edges in. Zip the film protector off. Alright, now, this will never stay on in bed without some help. And it's at the crook of his arm, so the gauze pads that I used to put on to protect it first won't, because it will slide down. So at this point, I'm now taking just the stretchy, non-stick fabric bandage. There's just enough on this. So you will cut a piece about 12 inches long. And you want to start it here, so it's not in the crook of the arm. And just snug enough that it's not going to slide off. So you have to ask, Dad, is that too tight? Okay, then come underneath it, don't pinch it, lift up with your finger and kind of seal tightly the ends so that it'll stay overnight. Now, he's fixed up for today. Here's where his other wound was. It was nicely healed. So I'm going to put a little lotion on there. But this one is going to stay. This is where his other bad wound was, and that's really healed. So for now, that's it. And I'm going to do it tomorrow, Wednesday morning before we leave. You should check on it Thursday. He's not going to have a shower. Jamie's going to wash his hair in the morning and sponge bath him on Thursday, because I take this off and the Tegaderm will come off and it need to be bandaged right away, and that's 7 in the morning. So I didn't figure you want to be over here then. So she's going to sponge him, wash his hair, get him all cleaned up. You'll check this in the afternoon Thursday and Friday, and I'll be back Saturday, so you should probably change it twice. If there's any questions, give me a call, but you should have everything you need right here in the bag. Thanks. Bye.